Today we're going to be discussing the Fitzgeral test. Now the Fitzgeral test is very closely related to the Faber and Fitzgerald static test, as we use those positions as our starting point. However, unlike those tests, those being static, Fitzgerald test is a moving or dynamic assessment of the hip. It is very beneficial for differentiating between an anterior and a posterior labral pathology. So let's go ahead and get started. Because Fitzgerald and Faber are our starting positions, we need to adopt a position that's very similar to that being 90 degrees of hip flexion and 90 degrees knee flexion. From here, we need to understand whether or not we're looking at the posterior portion or the anterior portion of the hip. To test for the posterior labral tear, we first need to make sure that our patient is relaxed and they're not holding any tone, so we can help them by kind of wiggling or oscillating the hip to make sure that they're not muscle guarding. And then from here, we're going to start in the Fitzgerald position, that being flexion, adduction, and slight internal rotation. Then we're going to move in an arc of motion into the Faber position. So this is the starting position, and this is the ending position. We just need to link those two together. All right? So starting position for posterior in the Fitzgerald position. We're then going to move into flexion, abduction, and external rotation. This is considered positive if there's a reproduction of the pain, specifically the pain, comparable sign, and or a click is reproduced as well, which would be common with the labral pathology. Additionally, if you are looking to exacerbate or reproduce the symptoms and it does not occur with just the movement, you can also provide a little bit of axial compression. However, note that that is not a defined portion of the Fitzgerald test. To test for an anterior labral pathology, you're going to do just the opposite. You're going to start in the Faber position, that being flexion, abduction, and internal rotation. And then you're going to passively extend the hip and combine that then with adduction and internal rotation. So with this one, you're actually going to move past the Fitzgerald position. The Fitzgerald position is about 50% of the motion, so it would look like this. You're going to move to Fitzgerald, but then also extend. Because as you extend the hip, based on arthrokinematics, you're going to move into the anterior portion of the femoral acetabular joint. So when we combine all that together, here's what it looks like. Our starting position is Faber. We're going to move through Fitzgerald and extend the hip while maintaining that adduction and internal rotation. Again, we can provide a little bit of a compressive force as we do that to recreate or produce that comparable sign. Note that it's positive if either pain is reproduced, again, the pain, or there is a click. So, have a go with a peer or colleague with the Fitzgerald test. Again, a moving dynamic test that enhances or builds upon the foundational knowledge of Faber and Fitzgerald. And let me know if there's any questions.